there, and welcome to installment 20 of Achieve Wellbeing. I'm Dr. Lisa Kirk Brown, Doctor of Public Health with almost 30 years of experience in preventive medicine, retired Air Force Lieutenant Colonel, and disabled American veteran. Today I want to introduce to you the second element in the personality aspects of Achieve Wellbeing, which are behavior and boundaries. Behavior and boundaries are a really critical part of increasing your state of comfort, health, and happiness. Last time we spoke about self-awareness, and I sincerely hope in the last few weeks you've been able to learn a little bit more about yourself and maybe understand what your motivations are, what some of your behavior is, and how it affects your state of comfort, health, and happiness. This installment, I want to share with you how your behavior and boundaries can be modified to affect your state of comfort, health, and happiness. Before I begin with my areas that I want to highlight, I want to again remind you to seek out either psychological or psychiatric help in this area of behavior modification if you have something that's beyond what you feel like you can actually change. Behavior modification is a really critical part of modern psychology, and there are many methods to change behavior, and I'm not going to go into great detail on all of those because, as we've discussed earlier, there's no shame in going to see someone who's a resource that can help you in areas that you can't help yourself. And there's nothing wrong with you not being able to know how to modify your behavior if you haven't studied that. So take away all the judgment from that, and please seek out those professionals in your life if you need that. And if there's something that you just can't seem to modify, it's okay. Not everyone is able to do that. We've spoken a lot about happiness psychology in the Achieve Wellbeing model because part of well-being is happiness. And so happiness psychology is instrumental in all of this, along with mindfulness. Happiness psychology indicates that you have a choice on how you think and how you modify your behavior. The reality is behavior modification starts with the recognition that you can change your behavior. First, you have to realize and believe that you can change your behavior in order to actually modify it. I've spoken to you about how healing begins with your thoughts. Here I want to introduce to you the idea of self-compassion. So self-compassion is really a tool to modify behavior. It links to mindfulness, and the first step is to practice self-kindness. So what is self-kindness, you may ask? Self-kindness is simply understanding why you behave and think a certain way, rather than punishing yourself. So instead of judging yourself for why you're thinking and behaving a certain way, it's really just the recognition that you're thinking and behaving a certain way. It's not about punishment, and it's not about judgment. So old thinking, the old tape recorder in your head might be, for example, I ate a donut today, that was bad. I feel like eating a donut today, that was bad. I feel like eating a donut today, I'm a bad person, or whatever the tape recorder in your head might say. The new thinking that I want you to take away is, I feel like eating a donut. I wonder why. Maybe I'm hungry. Maybe I want to treat myself. Maybe I just feel that way, instead of punishing yourself and going to the next step of being mean. The second step is to gain a sense of humanity, recognizing that you're not alone. You're not the only person who's ever wanted a donut. You're not going to be the last person who ever wants a donut. Other people have wanted donuts and ate the donuts, and other people have wanted donuts and not eaten the donuts. So you're not alone, and that's a key step of self-compassion, to realize that even if there's people out there who judge you for whatever your behavior might be, they too have something that we could judge their behavior as. So instead of lacing it with judgment and lacing it with the idea that you're alone and you're the only one to have this struggle, remember that you are not alone and that you should gain a sense of humanity. The third step is mindfulness, and what that is like we've discussed earlier, neither ignoring nor exaggerating your feelings of failure. So when you eat the donut, being present with the donut and really enjoying the donut is my recommendation. and not beating yourself up about eating that donut. It's quite a shift in thinking, and I think a very valuable one for your state of comfort, health, and happiness. I would recommend Dr. Kristen Neff's book on self-compassion for more information on this topic of self-compassion. It's been instrumental to me. I was given it as a resource from a dear friend, and I think that it can be very, very helpful to you as you discover what self-compassion really looks like and why it's important in your state of comfort, health, and happiness. Next, I want to express to you how important positive self-talk is in changing your attitude to yourself and towards changing your behavior. Practicing positive self-talk is really just about being your own best friend and letting the messages that you say in your head be ones of love and compassion and kindness, similar to self-kindness, and self-compassion, but more than that, it's the actual messages you keep hearing over and over. So instead of saying to yourself, we'll go back to the reference of the donut, just because I don't have another one, it's not that I'm against donuts. But I think what you should do is say, you've exercised a lot today, or, whatever, and you deserve a donut. Or maybe you say to yourself, I haven't exercised today, but I'm going to have that donut, and tomorrow I'm going to exercise and make sure that I get back on track to be healthy. Those are positive things that you can say to yourself. The negative things would be things like, you ate the donut, you're a fat pig, or whatever words you usually say in your head. I don't have a clue what they are, but I know that there's people out there, and myself included, that can become very self-defeating and very negative. And I've worked very hard not to do that anymore. I think, I don't know that I was ever really naturally totally bent towards that, but I do believe that all of us can learn from that and treat ourselves a little bit more kindly, as if our own best friend. If your best friend ate a donut, you probably wouldn't badger them about eating the donut. You would probably give them some kindness and some positive talk. So do that to yourself. And finally, setting boundaries with yourself and others is simply just saying no to things. And in our society and in our culture, I think we're taught that we should not say no, that we should say yes to things that are ongoing in our lives, and that it's better to serve and it's better to be selfless, and do things for others. And I'm all for that. I'm doing this blog for free because I believe in that, but I don't think it's healthy or increases your happiness and comfort to always say yes to things at your own expense. And I've been able to work with and counsel quite a few people on this, that it's okay to say to people, no, I don't have time for that right now because I need to rest, or I need to exercise, or I need to do something else. I know we live in a very stressful world, and there's sometimes not enough time in the day, but I want to encourage you to set boundaries with yourself and others, boundaries that are healthy to your own, yourself and your family, and your health, your happiness, and your comfort. It's okay to protect your health, happiness, and comfort. Only you can do that. No one else is responsible for that but you, and I would really encourage you to research some resources on that. Cloud and Townsend are what I would consider to be the experts in boundary setting. They have books on all types of things regarding boundaries. They were instrumental in my life as a 23-year-old woman. They really helped instill in me some behaviors that have definitely impacted my state of comfort, health, and happiness over the years. And I would really encourage you to read some of their books. If not that, you can also seek out from your counselor or psychiatrist some more information on boundary setting and how that is an imperative part of behavioral modification, as well as your state of comfort, health, and happiness. All right, so next time we're going to talk about self-discipline and how you do have self-discipline. I'm going to convince all of you listening that you have self-discipline and it can be used towards your state of comfort, health, and happiness. I thank you so much for watching, and again, please contact me if you have questions or information that you need from me. My email is drbrown, disabledveteran@gmail.com. Thanks again for watching, and we'll see you next time. Bye.